Good evening. It is good to see everybody. We are so glad that you are here for this event about medical debt and its impact on families and communities. It is part of our Life is Calling initiative. So we're thankful to those committee members for their preparation and planning, as well as several different folks and other committees helping with refreshments and audio visual and everything else that goes into this kind of event. I am not going to introduce our panelists. Mark Wilson will do that shortly, but we are so thankful that they are all here providing experience and expertise on this subject. The committee's initiative to have this event comes out of the East Meets Debt initiative that we partnered with several other churches in the community and East Alabama Medical Center, and you'll hear more details about that later in the evening as well. As we come together on this evening, please feel free to enjoy the refreshments if you need to get up and get a refill. Also, there's a place to sign in, particularly if you are visiting, to leave us your email address. And again, we're thankful that you're here. Let us open together in prayer. Gracious God, we are thankful for these opportunities to be with one another, to widen the circle of our lives, to deepen our understanding and empathy, to create a better understanding of our neighbors and all of the dynamics that affect people's lives. We're thankful for the conversation we can have this evening and all that we might glean from it. Through Jesus Christ our Lord. Amen.
Thanks, Tripp. We are indeed honored to have three distinguished public health professionals with us this evening. Dr. Gwendolyn Hale Cattledge, Mercer University, Ms. Sutricia Johnson, East Alabama Medical Center, and Ms. Frances Ford, Sowing Seeds of Hope in Perry County. We're going to begin this evening with a presentation from Dr. Cattledge, and I want you to know a little bit about who she is. She's originally from Fayetteville, North Carolina, earned a Bachelor of Science in Biology Pre-Med from Fayetteville State University, a Master of Science in Environmental Health with a specialty in Epidemiology from East Tennessee State University, and a doctorate in Epidemiology with a specialty in Environmental and Occupational Health from the University of Pittsburgh. She is certified in health ministry from Wesley Theological Seminary in Washington, D.C. She's been a trailblazer in many aspects of epidemiology and public health for 4 decades. She was among the first wave of African Americans in the United States to receive a doctorate in the field of epidemiology. And after completing her doctoral and postdoctoral studies at the University of Pittsburgh, she became employed by the Centers for Disease Control and Prevention, and just last year she retired after 31 years of service, her final position as Deputy Associate Director for Science. She even gave up 2 weeks vacation when she retired because she retired on a Friday, and then Monday she found herself in a new career. Talk about a quick weekend. Blazing yet another trail. She transitioned to become a professor of practice and the inaugural director for the Doctor of Public Health program at Mercer University, where they are the only doctoral program in the United States with a concentration in social epidemiology and diverse populations and health equity. Please welcome to this podium Dr. Gwendolyn Hale Cattledge.
Good afternoon. As he said, I'm Gwen, and I'm at Mercer University in the Department of Public Health. And I want to thank you for this opportunity to come out and talk a little bit about medical debt and lay the foundation so it will feed into our discussion panels that we will have today. So medical debt, all of us have encountered it at some point in our lives. Some have the finances to pay for the medical bills when we receive treatments, but then there are others that have a hard time paying their medical debt. It is said that about 19% of the population has accumulated medical debt because they can't afford to pay for the medical care at the time of services. Medical debt can drastically change people's lives, and it can cause stress and anxiety. There is a story where Debbie went to the clinic at work because she was feeling dizzy, had blurred vision, and also she was feeling a little nauseous. While she was there, her blood pressure was taken, which is a normal routine when we go to a clinic or a doctor's office, and she was informed that her blood pressure was at stroke level. So she needed to leave immediately and go to the emergency room. And Debbie went straight there. That visit at the emergency room saved her life. But the medical bills that piled up on top of the other bills that she had, it weighed her down. She did not know how she was going to pay for this health issue now that she had, on top of now having another bill to also inquire from the hospital. Remember, it is said that most people are only one paycheck away from losing things that they have acquired in life. Medical debt we see as an American injustice. It provides millions of people with from achieving financial stability, and they become subjects of emotional anguish. People, especially our older populations, should not have to choose between finding, getting food at the grocery store or deciding, should I, forfeit this and get my medication filled. How does medical debt affect us? Well, I'm glad you asked. Medical debt affects virtually everyone, but it can be most burdensome for people with chronic diseases such as heart disease, cancer, diabetes. Long-term illnesses can keep patients in and out of the hospital, and the only thing that they know for sure is when they finish that visit or when they finish that hospital stay, there's a bill that they're going to have to pay. Medical debt impacts our economic stability, our ability to save for a house or save for retirement, pay off other bills that we may have children, and many other things that we would like to do. It may cause us to delay foregoing medical care that we should really have. It may also forego treatment or any type of medication or not take medication as they are prescribed because you're trying to save money. Because the burden of debt, it can cause sleepless nights for many people, worrying about how am I going to pay this debt. So what it can also lead to is depression and also other types of mental illnesses. Medical debt can affect our credit score, which interferes with our buying power. And so our credit helps dictate where we live, the jobs that we have, and even trying to fix that leaky roof on the house. Medical debt, when left unpaid for 6 months, can lead to it going to the collection agency and later can lead to bankruptcy. When we as health professionals look at a person's health, we primarily think about the risk factors: age, race, gender, genetics, family medical histories. However, there are other factors that we in the medical sciences have looked at for decades that also play a role in disease, and they are called social determinants of health. These are your social economic status, environmental factors, educational levels. And in medicine and public health, we now look at medical debt as a social determinant of health. So these are all the factors that are associated with social determinants of health. So they are factors that affect where we live, where we work, where we relax, and where we play. Where you live can dictate how long you live based on the economic and environmental factors. Some cities like Washington, D.C. and Chicago have looked at life expectancy by the way the subway route is laid out. So if you live in a certain part, it'll tell you how long you're expected to live. I'm not going to go through all of the factors here because we don't have time. But however, I want you to clearly see that debt and medical bills can be detrimental to one's health. If you're in debt, you do not have the means to pay it. So it can affect where you live, the education system that your children have, access to healthy lifestyle choices. It may create situations where you feel discriminated against because of where you live. It can also affect the types of services that you get from your healthcare providers, especially if you do not have insurance. Unfortunately, all of these factors can play a role in the quality of your health. Medical debt is the most common collection to date, which surpasses your non-medical debt, such as homes, cars, and those kind of things. In October 2021, it was estimated that medical debt was as high as $141 billion in the United States, with the median amount being owed is around $2,000. About 43% of those with medical debt had a bill of at least $1,000. Medical debt can be the result of medical treatment, diagnostic procedures, hospitalizations, childbirth, ambulance transportation, and some people using the emergency room as their primary care facility. Medical debt is not reported to the credit bureau until it is 6 months past due. With medical debt, this means that households have less money to spend on the basics of food and housing. Research has shown that higher rates of medical debt are among young adults, people with low income, African Americans and Hispanic populations. Veterans and older adults are also significantly impacted, and medical debt varies by geographical location, but it has been observed that most of this is occurring in the South. So from this slide, on the right, you see medical debt, and you see how it's concentrated in the southern region. And so what are some of the causes of why people may have more medical debt there? It was observed that the South has 30% more medical debt than the North. 1 in 5 American households has unpaid medical debt. 28% of the households are African American, and 22% of them are Hispanic. Well, some of the reasons that may be connected with the high rate in the South is, as you know, the South is the diabetes belt, and also it is the stroke belt. And so with those come complications, and that can make expenditures be higher. The other thing I want to show you here is that if you were to overlay this second map on top of the first one, you'll see that most of the medical debt exists in states that did not expand Medicare. When we look at the top 5 leading causes of death in the United States, Alabama, and Lee County, Alabama, we see that the top 2 deal with heart disease and cancer across all of these locations. So there was a recent study done by the Kaiser Family Foundation, and they looked at what were some of the causes of the medical debt in the United States. And as you can see, 36% of that was attributed to chronic diseases. So studies have acknowledged that medical debt can affect everyone. However, this slide shows you some of the ones that are most vulnerable for it. So if you have an income that's less than 200% of the federal poverty level, and so that means if you have one person, the household income is around $27,000, and if you have 4 people in a household, about $55,000 as the limits. Most of these people have more than one chronic medical condition. They are between the ages of 18 and 64 years of age. They are women, they're African American, and they're Hispanic. Now, even those that are insured still can be vulnerable to medical debt. These are the publicly insured people with Medicare and Medicaid. And then there are also families that are underinsured because they don't have full coverage. And then, of course, the uninsured are vulnerable to medical debt because there may be a delay in care, their unmet medical needs, they forego medication, they don't go to the doctor, and they skip the medical treatments that they have been advised to take. So there was a study done by Harvard to look at what does medical debt look like in the United States. And we see by race that Blacks had the highest percentage. We see with educational level, the highest was with some college. By family compensation, we see that their youngest children were under 5, and we see that it occurred in the South. There was no difference between the poverty level in this particular one, just looking overall at medical debt. On this slide, we're looking at medical debt by age. And so if you look at it, most of those are less than 64 years of age that have the higher medical debt. And the reason that some of them don't have it with the older population, 65 and above, because that is the age that they start looking at them receiving Medicaid. So even when we look at persons across the country that have health coverage, there are 2 different types that we look at. One is a household where everybody is covered and has health insurance, and that represents 16.2% of the households, and so their median medical debt is around $2,000. However, when we look at households where everybody does not have health insurance, we see that that represents 30.8%, and their medical debt is $3,000. So with them not being totally insured, you would expect that their debt would be higher. Another thing that I thought about when I saw that is when you think about some of the changes in the tax returns, you can remember a few years back where if everybody in your household did not have health insurance and they asked you to supply the certificate, you were penalized for, I think, $750. So they get you going and coming. So this slide is a little bit different. This is looking at those people that had very high medical debt. And here you see that persons below the poverty level had the highest, and they were unable to pay rent or mortgage. They did not have any type of net worth. With insurance, they had either no or partial health insurance coverage, and they also, there was at least one member in the household that had poor or fair health. So there's not much data out there when we start looking at specific states, but I did dig to find a little bit for Alabama. So we found out that 21% of families have medical debt in the state, and that represents 1.1 million people. When we look at Auburn or Lee County, we see that you have 10% of medical debt, and that median debt is about $743. So this shows a map of the zip codes that I was given as part of what First Baptist looked at as far as their initiative. And so you can see them on the map. And what I want to say is that churches like Auburn First Baptist Church and organizations have been a blessing to some of the families here in this area. And so I want you to give them a round of applause. So I worked with one of my colleagues at the U.S. Census Bureau to try to get a little on the demographics that we could find for Lee County. And I know this gets a little small, but looking at age, we see that a great proportion follows what we had before, between 18 and 64, and you have a small amount of people that are living from 75 and 85 and above. Most of your population in these zip codes are white or black. You have a few Native American Indians and Asians. And with the males and females, they flip-flop, but they're kind of similar across the zip codes, except for around Auburn University, where it looks like they have about 72% are female compared to the 28% which are males. And then when we look at educational attainment, most people are at least high school graduates. You have some that have attended college, got associate degrees, bachelor's, and other graduate and professional degrees. And then we pulled the data for health coverage in Lee County. And it is good to see that most people have health coverage here. I think it's between 81 and 95%, which is really good. You'll see it stratified by private insurance and public insurance, and those numbers don't always add up, because you got to remember, some people, especially seniors, may have insurance that they carried over from retirement, and they have Medicaid on top, so they may have both. But it was also interesting to see that you have a small portion that do not have health coverage, and it goes from roughly 4.7% to 18.5%. Now, one other thing that I pulled was COVID has taught us that we can do some things in the medical field through telemedicine. So I wanted to see how many households in Lee County had computers, and as you can see, a great proportion have that, and how many have internet, and so they do. So this may be another way that some medical costs may be reduced a little bit using the new practice of telemedicine. Before you leave, there is a document in the back of resources that a couple of my graduate students and I put together, and these resources are for Alabama and some for Lee County. And so if you need help with medical expenses, you can contact one of these organizations to see if they can help. It may be that you need help with prescriptions or transportation, and even some will help on the medical bill. One thing that I want to stress with this is sometimes you think, oh, well, I'm not in that income bracket, so it doesn't apply to me. some of the organizations don't have an income restriction. So I'm going to tell you a quick example of how this works. I go around talking about chronic kidney disease in Georgia. And so usually with that, I will bring in some people who are living with that disease to give their story. There was a gentleman who was president of the Augusta Technical College in Georgia. He found out that he had to have a kidney transplant. Most of the time when people hear transplant, they say, oh, that's a lot of money, I can't do this, and that's not an option right now. But this person, since he was the president of the college, could afford to pay for his transplant. But the Georgia Transplant Foundation or Transplant Fund told him, no, we're going to pay for your transplant. And so what he did was took the money that he would have paid and he gave it to the community. So those kind of things are there where you can help somebody else when that organization helps you. I did call my contact in Georgia, and she said that she believes that they may do a similar thing at UAB in Birmingham through the medical school. And this is just acknowledging my graduate students, my colleague from the U.S. Census Bureau, the department chair, and our associate dean. And there's my contact information. So thank you.
While I introduce our next two panelists, I'm going to invite all three to come join us up front on the bar stools. Looks like the Auburn First Baptist Church daytime TV show up here. Thanks to Chad Parrish. We appreciate that. And I want to introduce them to you. Sutricia Johnson received an ADN from Troy University, a BSN from Auburn University Montgomery, and an executive MBA from Auburn University Montgomery. And based on a conversation before the program, she's probably going to have Mercer University in her resume because Dr. Cattledge was recruiting her for an online program. And I asked her husband, Frederick, who's kind enough to come this evening, welcome, we're so glad to have you. I said, Frederick, did you hear that? She's about to go back to school. And he said, I heard it. Because she's busy. She serves as Director of Case Management at East Alabama Health in Opelika. She has nearly 29 years of nursing experience that spans care in cardiac step-down, medical surgery, and quality. In her current role, she focuses on insurance, certification, and social work, discharge planning. She serves as a faith community nurse for the Opelika-Auburn area since 2009, and she is currently serving at True Deliverance Holiness Church in Auburn. Frances Ford is from Perry County, Alabama, and she is not a stranger to our church, a great friend of our church, and knows the way here, right, Miss Frances? She's a product of Baptist education as well because she has a bachelor's degree of biology from Judson College in Marion and also an associate degree in nursing from Samford University School of Nursing. She started her nursing career in neighboring Dallas County for 21 years. And then she returned to Perry County, where she served as the healthcare coordinator and now the executive director with Sowing Seeds of Hope, which you are familiar with, a faith-based organization that provides her and all of congregations like ours an opportunity to intertwine their faith calling and the calling of community. So she serves as an advocate and spokesperson for the county on health issues, has won many awards for this local work. I mean, when you see the list of accomplishments, you understand why. Free health screening for children, the Perry County Nutrition and Fitness Center, free blood pressure clinics weekly, diabetic education, quarterly health fairs, increasing the number of children with health insurance. You see what I mean? It just keeps going on and on. Energy assistance. Caregiver care teams, assisted in recruiting and establishing a dialysis center in Perry County. Frances, we are delighted to have you. So let's welcome now all three of our panelists. And first, Sutricia, I would love to start with you to talk to us about this issue from your perspective, working with our community in East Alabama.
Um,
I think you're on.
Good evening, everybody. Yes, being in healthcare for almost 29 years, and I was telling them earlier today that I've kind of gone the gamut from bedside nursing to home health nursing to social services. Don't ask me how I got there with a nursing degree, but that's where I am now. And also working with insurance. And so I did Dr. Cattledge did. I did a little research because I wanted to hone it down to our area, and I pulled the 2020 Census Bureau information. And it was a little bit surprising to me in that I noted that about 30%, 20% of our Lee County citizens live below the national poverty level. And right now, that's with East Alabama, with Lee County, that's 146% beneath the federal poverty limit. And, that was a little bit surprising. And it shouldn't have been because that's what I work with basically every day. But that equated to about 30,000 of our citizens, of our population of 160 plus thousand. That's a lot of people that are and in my line of work, a lot of times when these patients show up, it's not for lack of trying, it's not for lack of working, it's not for just the lack of not being responsive to the things around them. A lot of times, like Dr. Cattledge alluded to the social determinants of health. It's not who you are. Sometimes it's where you're brought into this world, the community that you're around, and the surroundings that you have. Um, One of the stories that I just like to share, because sometimes stories bring it to home, is there's a young lady that I know that's a single working mother. She's a Medicaid recipient, and she lives in public housing. She has a daughter, and she works a full-time job, probably two jobs at times. And because she's in public housing, when she was working, wasn't working, her rent was maybe, on a sliding scale. She gets a job and tries to better herself. Now her rent quadruples. And I'm thinking, what do you do? How do you get out of this vicious cycle of wanting to be better, trying to be better, but life circumstances keeps you in this hamster wheel? And so that's what we see a lot of times. And a lot of times in my line of work, I'm noticing that the Hispanic population has really grown exponentially in our area. And what we found is that a lot of times when these citizens, undocumented citizens, come to our area, they're usually coming to make it better for their family at home. And if one shows up and they found work and they're living the dream, for whatever you want to call it, then more will come, more will come, more will come, and before you know it, we have this populations of patients that they're uninsured. And because of their undocumented status, getting insurance is unheard of. And because of that, getting health care is a dream. It's a pipe dream. Something that could be dealt with, for instance, your blood pressure, getting that blood pressure pill, going to the doctor, doing the things that we sometimes take for granted is unheard of. And by the time they show up on our doorsteps at East Alabama Health, we're looking at dialysis. So it's just one of those things that I really don't want to take for granted. Healthcare is a ministry. We should be the eyes, hands, and feet of Jesus as we go about. And Chaplain Laura knows, and we work together a lot. We won't stop until we find a way. So we just won't stop until we find a way, because I've learned in this line of work that there are some that are in these predicaments because of the choices that they make, but there are others that are there and because of just who they are and the place that they landed in society.
Thank you for that. Ms. Ford?
Well, good evening. It's good to be back at First Baptist Auburn again. Just sharing and just thinking as I was listening at the presentation, I thought about there are several incidents that came to my mind, but one came to my mind is because it's a couple, the husband and wife. They worked very hard. They worked long years. The wife, she's a retired RN. The husband, he retired from the county that they had worked. They put aside money and saved, but for some reason, because of the fact that they began to have chronic health problems, began to have heart disease. The gentleman, he had a fall and had a fractured hip, had complications from the hip, and all of a sudden that savings that they had, it was soon depleted because in Perry County there is no hospital. So they're having to travel to Birmingham or to Tuscaloosa to receive not only the health care, but for rehab. That means that they're out of their home. They're both in their 80s. So that means when one is in the hospital, either they both have to be at the hospital, and that means they're having meals that they're having to pay for, or they're having to stay at home and they're having to pay someone to stay with the other one that's at home. So they have depleted their savings. Then when they depleted their savings, because the illness that they have are chronic illnesses, they have like atrial fib, they have had blood clots, they've had COVID, and because they have just had all of those chronic diseases that they have continued, they're on medication and asthma and COPD. They're on those medicines that are quite expensive. And one time that they had something, they couldn't afford them. And so he was struggling, even just this year, that he was struggling because he had to meet his deductible, which was $480, and he had insurance. He had Medicare, and he also had a supplement, the Part D. But he had to pay that $80 before they would pay for his insurance would cover any of his medicines. So that meant that out of their income, they had to struggle to try to pay. And he's on about 12 medicines. She's on about 18 medicines a day. Their medication bill, when we put them in Medicare Part D, his medicines for a year would run $22,000 if they had to pay for them. Hers would run $27,000. And even when they look at having them on Medicare Part D, there is a copay, but because their medicines are so expensive, the copay on 5 of his medicines is $60. So he still is paying $400 a month, and that's just for the copay. So he has insurance, and they are both where they have insurance, but they're still struggling because they have an income a little around $2,000. But when they pay $800 plus a month for medication, they still have the light bill, the water bill, they still have the gas, they have to pay someone to drive them back and forth for doctor's appointments. And so they are struggling. They did all of the right things, all of the things that we talk about, that she was educated, she worked as a nurse, she gave back, she was a community person, all of that. But at the end of the day, that medical debt, that medical expense that they have because they're in those senior years, those golden years when they should be enjoying life. They're struggling and deciding whether they're going to eat or not. What are they eating? They're looking at food giveaways to make sure that they're able to have the food because they don't qualify for food stamps. They don't qualify for those, so they're looking at how they can. So we see the struggle of individuals having to decide what I'm going to spend or what I'm going to pay this month. How can I go somewhere where maybe they're doing energy assistance and they will pay our light bill this month, or they will buy gas so that we're not cold. And so they're doing, and it's not because they didn't work. It wasn't because they didn't prepare. It's just because of medical debt and the situation and living in a community like Perry County where there's no hospital and there's no specialists. And when they receive that care that they need, they're having to travel out of the community. So that's why I see in some of the things that we deal with and looking at medical debt.
Thanks for that. We appreciate it. And we'll take some of their questions because I know these people, and boy, they're going to have some questions for y'all in just a second. There's no doubt about that. But here's a quick question. You each have significant experience in different aspects of the public health field. This is not a new problem. It's been with us for a while, but it is in the news more. There was an editorial that the OA News, our local paper, ran from St. Louis in the Wednesday's local edition of the paper. We're having this panel tonight. From where you sit, is there more emphasis on this problem? Is there more light shed on the problem now than you've seen in the past? Any thoughts on that? Dr. Cattledge?
There's a little bit, but I think it needs to be more and stress how this is really devastating a lot of households. They shouldn't have to, like I said, choose between food, basic things, food, housing, prescriptions. If they don't get the prescriptions, they're not going to get better. So they're going to get worse. And when they present themselves at the doctors, that's going to be a higher bill. So I think we need to find ways through legislature or organizations like RIP and maybe churches and other organizations joining with them to try to help pay this down. Let's use that Samaritan spirit and help people out. Go that extra mile.
Excellent, thanks. Sutricia?
Well, it is. It's definitely a problem, but I can speak for East Alabama Health because that's kind of all I've known for about 29 years now. But East Alabama Health, we do have a program called Uncompensated Health, and we are a nonprofit organization. And because of that, we do have a program where if a patient does not have insurance, those are the ones that the program really benefits, is that there are forms that they can fill out to where they will be reviewed, and if they meet the criteria, they never receive a bill from the hospital. And also, if a patient does not have insurance, we also automatically cut their cost or their charges 45%. That's without even asking. But what we've learned is that a lot of times, we're prideful people. And even though the programs are there, opening up and being vulnerable in those types of situations is easier said than done. And so the program is not utilized that much. It's there, it's been there for years because it's kind of almost a government mandate that being a nonprofit organization, in order to get the disproportionate shares that the government has for you, you have to help try and alleviate healthcare disparity. And that's one way that we do it. Also, we partner with Mercy Medical. A lot of you all may know that program as well, where there's a nominal fee, but if they show up, they won't charge them if they don't have it. But they do charge a $25 nominal fee simply because they want the patients to have a little bit of ownership. But they will never turn anybody around. And also, the Lee County Area Agency on Aging is also a wealth of information. They're there. They can provide, gosh, I want to do a plug here. I don't know if this is where I need to say it, but these HMOs, be careful. Beware, because it's a marketing ploy. Now, granted, and sometimes you will find yourself in an underinsured situation simply because of the low premiums that are very enticing, or the no premiums versus keeping your traditional Medicare and Medicaid and your Part D. Be careful. I'm not saying not to, but if you or your loved one is considering transitioning from a traditional Medicare to a managed care, be sure that you do your homework. If you're in this area, Lee Russell has a SHIP program or SHIP coordinator. That's your state health insurance program. They will take your list of medications, make sure that what you're considering is covered under this HMO, because if it's not, you may go from paying $10 copay to $80 copay, and you're thinking you're doing yourself a favor by having a no premium or low premium healthcare policy. So I do believe that there are programs in our area. We just need to tap into them and utilize the resources that are here. So
Francis, what about rural Alabama?
Oh, rural Alabama, I think that when she said that, let me just piggyback on that. I will encourage you when people call you on the phone and say they want to review your health plan with you and that they want to help you to lower your debt and to change your program so you don't have deductibles and that they're saying you don't have co-pays and you don't have premiums, please don't do it. Because a lot of times what they would do, you have a program that someone has looked at and they have reviewed your program and make sure you're on the best program, whether it's a health plan or whether it's a Part D program. And that individual that's on the phone, they're only trying to make a sale so that they can be compensated. And so, but once you do that, if it's not doing if it's after the enrollment period, unless you're dual eligible, you're unable to change. And you got to live with that for that year until they start doing enrollments again in October. So when people call you on the phone, just say no. And just say no. That's all. Just say no. That's what I'm saying. Just say no.
I would like to speak to that because, we've gotten those calls too, but reported on, received views from the Medicare Foundation that really checks on that a tremendous number of people have signed up without meaning to, trying to be nice and answer questions, but there are thousands that are on these plans. And let me tell you, that didn't mean to, but let me tell you, I've got a niece that's on a plan, but she has one that she lives in a metropolitan area that's got all the services, Kaiser Permanente. It's got all the services. But if you sign in this county or some other small county, you don't get them. So we really need to be careful. In fact, the best thing is just to shut the phone down, don't listen, because, we, a lot of Southern, we like to be nice. My wife tells me I'm not as nice as I could be, and she's probably right. But it's just, I'm kind of answer the phone with what do you want?
I bet when Francis says no, though, she says, no, honey, something like that, I think she probably got that down. If you saw the newspaper article today, our local paper, about this event, you learned about a new program called East Meets Debt. And I want to call on Laura Eason, chaplain at East Alabama Health, who's with us tonight. Welcome, Laura, to this podium to give us an overview of that program.
I didn't see the paper today, but probably one of the things that you did not know, because I'm pretty sure he didn't claim responsibility or credit for it, is it was actually your pastor that stopped me in the parking deck 2.5 years ago and said, hey, I read an article about a church in Birmingham that partnered with the company called RIP, which is, Rest in Peace Medical Debt. And I'm just, would the hospital be interested in maybe us partnering with, or what do you know anything about that? Well, that really sparked my interest. And so 2.5 years later, here we are. And, but we didn't know COVID was going to hit in the middle of all this. And that kind of stopped things. But we were able, I immediately got on my phone and didn't even pull out of the parking deck, started pulling up RIP and figuring out what they were and what it was about and stuff. And I know y'all have heard a lot about that, but what we've kind of found out is it was actually about 3 days later that Kim Hudson from the Hudson Foundation contacted me, texted me, and said, hey, we're interested in maybe helping with some medical debt. We read this article in the Birmingham News about a church in Birmingham, and so we'd like to find out more about that. So I contacted RIP, and I found out kind of how they operate and stuff, and very quickly realized that they couldn't target it to one hospital. I know y'all probably already know this, but they pay a debt collector group for their whole batch. and it could cover several hospital systems and across several states. And so one of the things that the Hudson Foundation and I know Tripp with First Baptist wanted to do is to Lee County money to stay in Lee County. And so that's why they were wondering if the hospital, East Alabama Health, would be even, would be interested in working with a group like that. And so it is definitely a community-led initiative. Well, we started meeting and then COVID hit, so we stopped meeting for 2 years. And then other pastors found out about it and they contacted us. And so right now we have, we identified the hospital, there's a lot of HIPAA rules and things like that. And so we have to be very careful about how we do all this. But we were able to pull together basically over 6 years. These are the figures that you probably saw with the East Meets Debt. Over 6 years of medical debt that began from last October backwards. We were able to identify 2,630 families that were living well below the poverty level. They didn't have Medicare. They didn't qualify for, or had never applied for Medicare, or didn't qualify, weren't old enough for Medicare, didn't apply for Medicaid. So they had no insurance. They were self-pay. And they had no resources in order to get the pay. And so we had this certain criteria that the computer was able to kind of pull together. And it was about $17.9 million. And so our CFO got involved and our other vice presidents, and they came up with, okay, based on that's probably money we're not going to get anyway. We're keeping it on the books. We're employing people to send those letters out regularly. We just want to write this off. We just want to kind of get this off our books, not worry about this anymore, and we want to help people. We want to be a blessing to those families that are burdened by that. And so that's where they said, we'll take 2 cents from every dollar to just write that off. And so that's kind of what we came up with. And so the big goal for the 6 years was $358,000 that would forgive the medical debt of $17.9 million. Well, Sam and Leanne and I got together without the committee there and said, that's a really big ask. Let's go back and let's do a 2-year plan. And so I'm happy to let you know that, so the 2-year plan was about $152,000, and it was about a little over $8 million, and it was about 1,300 families. Because with HIPAA involved and everything else, we knew that as checks or donations came in, we needed a goal in mind that then we could just wipe out that entire group. Because we never wanted to be, the hospital never wanted to be in the business of, okay, well, we've got $40,000, so let's take of that $358,000, let's pick this family, and then let's pick this family, and then let's pick, that we didn't want to be in that business. We wanted a blind kind of this whole group without knowing who they were, what their condition was, anything about them. And so the first wave of that, at least from what I've heard over the phone, I don't have the money yet, but between Cornerstone Church and their donation, that they did a pretty big donation at Christmas time, between Auburn First Baptist Church, Auburn United Methodist Church has just done a big Easter offering, and they've kind of told me what they think it's going to be. And then we also have First Presbyterian Church in Auburn just contacted me and said what their check was going to be. And if I'm doing my math right, we are really, really close to $150,000. And so we are about to send letters out, and I don't know what color envelope we're going to use, but we're going to use some kind of bright colored envelope. And so people will know it's a real thing. Look for your yellow envelope or blue envelope or whatever, because we don't want it to be just thrown away thinking it's another bill. If they see East Alabama Health on the return address, may throw it away if they think it's another bill. But anyway, we are very, very close to being able to send that first wave of letters out, and it's because of First Baptist starting that whole program and being the first church to kind of pony up and give us that check. So first of all, y'all deserve a hand. So we're really excited about this possibility. And again, nobody really knows about it until the article in the paper today, which I need to go find a paper and see what it says. But nobody, and I kept telling when the reporter called me. I mean, the phone conversation was about 30 seconds long. She said, I have got one question. And so I answered that one question and by saying, well, it was really a community-led initiative. And I had to tell her 3 different times because she said, so why did East Alabama Health start? Well, it was really a community-led initiative. Auburn First Baptist came to us. Well, why did the hospital decide to do this? Again, it was a community-led effort, you know. And then I said, I really would like for you to talk to these 4 churches, you know. And she was like, no, we're not going to talk to anybody else. Thanks so much. Bye-bye. You know, I was like, so anyway, but at least she talked to Tripp, I think, and she was willing to call and talk about this. But I do have one story to tell. One of the things that bothers me most about medical debt is deferred care. That's one of the things that is, in my mind, just tragic. And I know that just recently I went and prayed for a lady, and she's got a good job. She thinks if it's a good job. She's worked really hard. She owed the hospital some money. She's got diabetes, and so she started having circulation problems. She had a little injury on her foot at the warehouse that she works in, and she's on her feet all day long, and so she kept delaying coming to the hospital or going to a primary care physician. She had no insurance, so it was one of those things where she knew that, okay, I owe the hospital. They're not, I can't pay them that, and it was not a very big bill at that point. And so, but I'm just gonna take care of it myself. I'm gonna take care of myself. I'm gonna take care of myself. By the time she came, half of her leg had to be amputated. And so, talk about tragic. Now, once we found out about it, we were able to, at least after she went to rehab and stuff, we were at least able to build her a wheelchair ramp. That's one of the things that I get to do with my Patient Crisis Fund, is we build a lot of wheelchair ramps. We provide transportation for a lot of folks that don't have a ride, and we are able to do some things to help patients in crisis. But again, if she had just come earlier, it was a wound that could have been treated and could have been, you know, it would have saved her leg. And so those are some of the things that medical debt, not only do they have to choose between paying their rent or putting food on the table or buying their prescriptions, sometimes it's deferred care, and it can be really life-altering. But East Meets Debt, when those letters go out, that is definitely going to be life-changing. So thank you all for everything you're doing.
Thank you. And Laura, you're right. Tripp wasn't going to tell us that, so thanks for telling us. Please. We're going to bring a microphone to you so that everyone will be able to hear your question.
Well, I've mentioned this program to several friends who go to other churches. If they privately, individually want to give, or if they want to encourage their church to get involved, how do they do that?
So one of the things the committee said, that there may be some people with word will spread. It's a small town, small community, and another church may not want to participate, but an individual may want to. And so we haven't gotten a single donation from an individual yet, because I don't think people know about it. But we went ahead and the foundation set up East Meets Debt from the EAMC Foundation, and so there is a bank account there, and I guess that's actually where y'all's check went, and Cornerstone churches went, and so it's there, ready for individuals as well if they want to give. So please let them know. They can just send a check. It needs to say East Meets Debt in the memo line, but made out to EAMC Foundation. Tell them to contact me, and I'll email this, or contact Tripp, or contact Tim Hudson Foundation, any of the pastors that are a part of this, Cornerstone or whatever. We all have the same document. They're the ones that put it together, and so I just forward it. They emailed it to me, and I just forwarded it to whoever.
Thanks, Laura. Glad you were in the parking deck that day. It was a good moment when y'all saw each other. We know. He beats us there, you know. Wayne. Oh, wait, say that again about football. People need to hear that.
Football is only the second most competitive thing in small southern towns. The competition between churches is the most. And I'm wondering why the churches that are already involved in this do not collectively contact all the other churches and explain what we're doing. Maybe this has already been done. But, I mean, it's just inconceivable that Holy Trinity and and black churches and others would not be involved in this.
Well, and so far, I think it's Auburn churches right now, and I think it's because of pastors kind of talking to one another. And while we're not, I'm a youth minister. Can everybody? I was a youth minister for a long time with no microphone. So the biggest thing is to make sure that I think I asked the same question. What's wrong with the Opelika churches? Why don't they know about this? And there's definitely some competition between Auburn and Opelika, so maybe we'll get some of our Opelika churches involved as well. But I think the article today, I'm assuming I'm going to have a lot of voicemails tomorrow morning. I'm hoping. And so thank y'all for doing this program, because I think if this program had not appeared, the reporter wouldn't have. Because I know that the hospital, we're not interested in getting a pat on the back or anything. We really wanted this to be a grassroots, local church kind of initiative.
Hold on just a second. Let me get one over here, and then David, right there. Hold on just a second. Got there, and then we'll come back to the other side. Go ahead.
A question related to Dr. Flint's question, and this is to the lady who's connected with True Deliverance. I know they started their deal with the community center, but do you know whether or not they consider joining this campaign, or Bishop Tolbert's been trying to talk to these ministers of these black churches about getting involved with this too? Because, I mean, if blacks are more likely to get into this medical debt than any other group of people other than Latinos, you would think that the black churches would at least know about this. Thank you.
Well, like Chaplain Laura said, I think the word has not gotten out there. I would not doubt that our pastor would. Now, will he be the initiator of pulling all of the black churches together? I can't speak for him, but I think once the word gets out there, and with me definitely being the Faith Community Church nurse there, I'll definitely put the word in his ear, and then we'll see what happens from there. But, as far as pulling everyone else together, I really can't speak to that right now, but I would hope that we would be able to congregate and at least support the efforts as well.
And some of the best initiatives in this kind of work, and any kind of work, start as a mustard seed and then grow. We got plenty of parables on that. Good.
I just want to ask, do you all have a ministers alliance here? Because you could go through that to get to the churches.
Go ahead with your question there.
Okay, I wanted to mention something to chaplains. What she's told, that was a clear case of workman's comp. A person that didn't report the accident, there's supposed to be something by a big notice by the clock-in place or wherever, but a lot of companies don't do a very good job of doing that. But when you're hurt at work, you got to tell them then, and we need to educate people that work, especially people that work on a time clock that making low pay. And I'll mention another thing, Medicaid and poor insurance is also, we talk about how many people in this county's got insurance. But Medicaid, we've had plenty of people when I was in the mental health section when I worked there at Phoebe Putney Hospital. And we had 4 days to get a person off alcohol and cured. We had 4 days to get a patient that was psychotic on his medicine and cured. 4 days doesn't do anything but get the medicine level, and they don't know enough not to go home and flush it because it makes them feel like they're in a straitjacket. A lot of people in our area were bipolar. We thought it was in the water maybe, but there were so many that they needed more treatment than that. And all we could do is get them on medication and let them go. So when we talk about debt, we don't say, oh, okay, we got a lot of people insured, but I don't believe that that's insured much. I had a girl to come in the food bank at our church in Columbus. She's 19 years old. When she walked in the door, I could tell that every joint in her body hurt. She was thin as a rail. She had been in the hospital 4 days. She was not helped. She had sickle cell leukemia. So there's a need is greater than you could imagine.
Well said. Gerald Johnson's got a question. If you reach backwards, you'll find a microphone near your head.
We believe that if it sounds too good to be true, it's probably not true. Writing off a medical debt sounds too good to be true. You're going to have a real challenge to somehow tell that story in a way that it's believable, and I certainly wish you well with that.
And we're still trying to decide who's going to sign the letter and what phone number is going to be on the letter. Because who's going to be getting those phone calls?
Well, it's as you are already aware, of course, that will be critical because it just sounds too good to be true, and that's going to be very hard. For the panel, what impact would Medicaid expansion make in this state to this problem?
Dr. Cattledge, you want to start?
I wouldn't say I thought I saw a number, it would help 300,000
300,000?
if it were expanded. That's what the literature is showing for Alabama.
Thoughts on that, Francis?
I think that if we look at having Medicaid expansion, a lot of rural hospitals that are thinking of closing, and those hospitals will be able to stay open and will not struggle the way they are. Some of these individuals that you're having now to help would have insurance, and they would be able to receive the health care that they need. So I think that expanding Medicaid would make a big difference in Alabama, not just helping that 300,000 individuals, but helping those hospitals as well to survive.
That's a good point. Sutricia, want to add to that?
Well, yes, I definitely agree that it will be impactful to the hospitals as well as the private physicians. A lot of times the population will not go, even with Medicaid now, they will not go because they have a copay that they haven't paid or a bill that they haven't paid. So expanding it and giving them more access will not only help the hospitals, but our private pay physicians as well.
Thanks for that. Other questions, comments? David's running the microphone to you. Looks like an Olympic athlete handing that torch off. Look at there.
Can you hear me? If one of us knows someone who is on dialysis, and we wanted to ask them if they knew about this, what would be the question, or what would be the question to ask them? Place at the table, or
In terms of assistance?
this everything you're talking about putting together, or that has been put together?
Yeah.
Information in the resource from the American Diabetes Association, and there are other companies out there, organizations that look at specific for diabetes. And remember that dialysis is coming from different diseases, so it could be hypertension, it could be psychotropic medication.
It could be.
Those obesity will all lead into dialysis. So just have them call them. A lot of the people that I talk to on that resource, they are willing to assist how they can. So it's just making that call. And for some of them, there is a specific person they can reach to.
For places like Fresenius, which and I can't think of the other one right now, and
DaVita.
DaVita, yeah, they're more than that, I'm sure. But is there information at each of those places where a patient can
Each one of them should have a social worker that has a knowledge of the community resources. So I would suggest that they speak to their social worker in their clinic.
Thanks for that. Last words from our panelists to these folks who've come out tonight. You've learned a lot tonight, right? Yeah? You're ready for next steps, and you need that encouragement. And so based on this conversation, Gwen?
I would say if you need help or you know people who do need help, first go to the resource and try to see what help you can assist them with, because if there's an organization that can pay for it, that's going to help them financially do the things that they need to do, because they don't need to have that added stress. Just think about the extra stress for a person who has hypertension, not on medication. You're talking about a stroke or could die. The same thing for in the case of cancer. If the cancer is in remission, it can come out of remission because they're stressed out. So do what you can to assist others in finding assistance that they can use.
I agree with her on that. And one of the things that we want to talk about and help people to realize is there are resources in your community for senior citizens. I always refer them to their area agency on aging because they are there to assist them. If it's individuals that's uninsured, now especially with medication, you have like Good RX, you have Single Care. There are other prescriptions that, and they can go to the website of that pharmacy, that whether it's Pfizer or whatever type of pharmacy it is, that they will also have indigent medicine assistance programs. And so help those individuals, because if you have diabetes, if you have hypertension, you have heart disease, I don't care how well you eat, I don't care how much you walk, you've got to have your medication. And so those individuals in trying to stretch a month's supply for 3 months, it doesn't work. And so we need to help them to be able to meet their needs, to help them to have the medication they need and go to see the doctor. Help them to know, and it's wonderful for you all to be resources. Learn all you can so that you can help somebody else. Because most times the people that need it the most are the ones that haven't heard it. So please be willing to share and be a resource for your community.
I can definitely piggyback on them. Be resourceful. Lee County, Lee Russell Area Agency on Aging is right next to the Jeff Coat. I mean, not Jeff Coat. Not that one. The Justice Center. There are multiple programs under that one building. Just be resourceful and be there for the ones that don't have access to that information.
And thanks to Chad Parrish, this panel discussion is a resource. It'll be available on our church's website. The PowerPoint will be available as well. And so you could refer people to some of this information. The handouts in the back, we hope that you'll pick up some of those. Thanks, Dr. Cattledge, for preparing that. I think from all of our congregation, to you three and also to Laura for being here and contributing, we say thanks for all that you do, that behind the scenes and in front of the scenes and in the scenes, all throughout, for this and so many other issues related to public health. You are our public health heroes, and we appreciate you so very much. Let's show our appreciation. They'll remain around for a little while, and we appreciate Francis's daughter, Marcia, for coming this evening and driving Miss Francis here. We hope you'll stick around, speak to our panelists, and thank you, thank you, thank you.